Good evening, everybody. This is Dr. Kurt Woeller. I appreciate you joining this webinar this evening. This is an important topic. It's not a topic that I have talked a lot about in the past with respects to these webinars through Great Plains, but I feel it's critically important because there's a tremendous amount of people who are suffering with rheumatoid arthritis. I've seen quite a few people in my practice over the years. And it's a classic, autoimmune disease that can be really helped with complementary medicine, from supplement therapy to diet therapy, etc. So I'm excited about providing this information for you tonight. This recording will be recorded, by the way, and then housed on Great Plains' website for future use. So with that, we'll go ahead and get started, okay? Just to give you a little bit of background on myself, I have been doing webinars now with Great Plains for about the past 4+ years. My practice is varied amongst a wide variety of patients. I deal a lot with kids on the autism spectrum. I also work with people with other kind of chronic health conditions, autoimmune disorders, chronic fatigue, people with MS, Parkinson's, as well as individuals with rheumatoid arthritis. I got my start many years ago, back in the late, around 1998, when I first went into practice, and have been studying nutritional medicine and what we call integrative medicine for all that time. I do a lot of consulting with doctors around the country, teaching them different aspects to functional diagnostic testing, the implementation of complementary medical therapies for patients with rheumatoid and other types of disorders. So I think you'll find this information quite compelling. Some of it you may have heard before when you're talking about dietary intervention, but I think there's going to be some things tonight that maybe you're not aware of that could be useful for you. If you're a practitioner working with people with rheumatoid arthritis, I think you'll find this information helpful. If you're an individual yourself or you're trying to help a loved one with RA, then I think you'll find the information quite useful. By the way, if you want to find out more about me as an individual practitioner, you can go to my main website, which is drwoeller.com. You have connections to my private practice. I have resources of different books, webinars, my lecture schedule, all on this website. So that's a good place to go to get current information. All right, so the lecture overview tonight, we're going to talk about, simply define what is rheumatoid arthritis, what are some of the common symptoms, some of the current statistics, and what we consider to be some of the causes or triggers for RA, testing recommendations. I'm going to introduce a concept tonight called the chronic stress response, and then steps that I feel are important for any individual with RA to take to really improve their health. I'm going to introduce a concept of something called tetracycline or minocycline treatment, and then we're going to end the evening talking about low-dose naltrexone. So what is rheumatoid arthritis? Well, it's a devastating disorder. As many of you know, it's caused by the immune system starting to attack our own body tissue, primarily the joints, but it can be inflammation not only of the joints, of the supporting connective tissue such as the tendons and ligaments, that leads to the inflammation and deformity of the joint structures. The onset of RA for many individuals can be slow at first. Oftentimes people complain of mild stiffness in the morning, maybe some joint discomfort, perhaps associated with a periodic low-grade fever, and then the symptoms usually intensify over time. I have seen some patients where the onset of rheumatoid arthritis occurred quite rapidly, secondary to an infection, like an intestinal infection, which triggered a reactive arthritis that then flipped over into more of a long-term rheumatoid arthritis, or an injury. I actually had a patient years ago who had a fall and developed symptoms of rheumatoid arthritis quite rapidly after that injury. Now, the current statistics for rheumatoid arthritis in the U.S. is approximately 1.3 million individuals or adults who are diagnosed with RA. It makes up about 1% of the U.S. population. Women tend to outnumber men about 3 to 1, with the average onset occurring between the ages of 30 to 60 years. Now, a similar arthritic condition of juvenile arthritis, or which is similar to rheumatoid arthritis, occurs in about 300,000 children in the United States. So what are the causes? Well, the reality is that the causes are multifactorial. A lot of medical researchers agree that it's likely a combination that genetics may play a role, induced with certain environmental triggers. And so there's a multitude of things that can happen. So what are some of the factors that we know or are suspected to help develop RA? Well, as I mentioned before, I'll mention something about stress, but stress can be a potential trigger for some people's rheumatoid arthritis, whether it's chemical reactions to stressful events from a physical or emotional trauma. Now, what's interesting about this is that many of the people that I see with multiple sclerosis, another autoimmune condition, often they'll talk about the fact that they went through a very stressful time in their life. It could be a stressful period of time that had taken place over months, or a very stressful event that occurred in a very short period of time, and that's when they started to manifest with the first symptoms of MS. I've seen that as well with rheumatoid arthritis. Acute and chronic infections, there's suspicion about certain viruses. I highlighted here bacteria in red because I'm going to talk about that a little bit later. That bacteria may be a trigger for RA. Certainly food reactions. As a complementary medical physician, I've seen a lot of rheumatic type disorders improve with elimination diets and get worse when people eat food that they're highly reactive to. Certainly intestinal imbalances from chronic infections, even the aspect of heavy metal toxicity, which can weaken the immune system, has been associated with rheumatoid arthritis. When you're looking at doing blood testing or standard blood testing, essentially, for anybody with RA or who's suspected of having RA, I feel that to really get a good overall picture, you need to do more than just the standard inflammatory and autoimmune markers, which are certainly helpful. So things like the C-reactive protein, SED rate, ANA, RA factor are important. But I think people should also have a further investigation into their immune system, looking at total immunoglobulins, the IgG, the IgM, the IgA, to see if there's any deficiencies in those categories which could predispose them to some type of chronic infection. Thyroid disorders, I've seen a fair amount of people who have autoimmune diseases in general, MS included, RA included, who tend to have a thyroid problem. This is not to say that a thyroid deficiency is going to be the complete fix, if you will, to rheumatoid arthritis, but certainly having hypothyroidism does not benefit anybody, and it is something that needs to be addressed. And of course, in certain rheumatic disorders or autoimmune disorders, the overactivity of thyroid can occur as well. But in the vast majority of people who have chronic ill health, they're usually dealing with some type of underactivity of the thyroid. Looking at B12 and iron anemia is important, and then looking at hormone deficiencies, whether it's deficiencies of cortisol, sex hormones such as testosterone, progesterone, estrogen are also important to evaluate. But in reality, we need to look a lot deeper. Okay, those are important tests, but for the vast majority of people who are dealing with rheumatoid arthritis, what's happening is a multi-system breakdown that not only involves the immune system, but also involves commonly the digestive system, the hormonal system, the aspect of opportunistic infections, and the way that stress plays a role in all of this. So when I look to do a further evaluation on somebody with rheumatoid arthritis, I absolutely want to make sure that we're assessing digestive function comprehensively. And one of the tests I'll do is a comprehensive digestive stool analysis to evaluate for the presence of opportunistic bacteria, the overgrowth of yeast, parasitic infections, which can put a strain on the immune system. And then also, how well is that individual digesting food? An organic acid test, specifically an organic acid test from Great Plains Laboratory, is critical because it's going to look at metabolic imbalances that will just affect health in general. but it also looks at biotoxins to yeast and Clostridia bacteria, and I'll come back to Clostridia bacteria here in a moment. Food sensitivity testing is critically important. I not only want to look at IgG sensitivity reactions, but also look at IgE food allergy reactions, because both put a strain on the immune system and can be a trigger for inflammation. Gluten sensitivity testing is important. You don't have to have celiac disease, which is an autoimmune disorder to gluten, but you could just be gluten intolerant, where the immune system creates an inflammatory reaction to gluten, which can just worsen an inflammatory reaction in the body. I do a lot of salivary hormone testing in my practice, particularly adrenal testing. The adrenal glands are part of our glandular system that controls inflammation, and the output of cortisol is critically important for controlling not only inflammation, but it helps to control all of the body systems as well. So the salivary adrenal testing is very important to get a really good representation of what's happening with the adrenal glands over a 24-hour period of time. And then toxic metal screening. I like doing a hair analysis on people just to see what they've been exposed to, potentially what heavy metals they're accumulating in their body, from lead to arsenic to mercury, because these are all important factors with respect to how these things can stress the immune system. Now, all of these tests can be done through Great Plains Laboratory. Great Plains has the organic acid testing, hormone evaluation, comprehensive digestive stool analysis. It can look at food sensitivity reactions, heavy metals test screening, as well as looking specifically at gluten reactivity to either define celiac or at least define gluten sensitivity. So what are some of the things that we know that can make rheumatoid arthritis condition worse? Well, as I mentioned before, chronic infections can have a broad effect on a wide variety of autoimmune disorders. Viral infections, parasitic yeast, all will certainly put a strain on the body and create a worsening effect with respect to the immune system. Again, I highlighted here in red bacteria because I'm going to touch on that in a little bit here, more specifically with respects to rheumatoid arthritis. Okay, some other things that we want to touch on are some things that you can look at, and this I'm going to talk about a concept here called the chronic stress response, but inefficient sleep and a faulty diet can also put a strain on individuals' health, which just worsens their overall ability to fight off these specific disease conditions. So what is the chronic stress response? Because this is an important concept to grasp when you're dealing with anything that is of a chronic nature, because everything that's linked to the different organ systems in the body all respond to how our body interprets stress, not only from a mental emotional standpoint, but a physical standpoint, and how these things can then relate to different disease conditions. And let me lay this out for you. I know this is a busy slide, but just follow through if you will. On the left-hand side, we have potential sources of stress. Okay, so from anger to worry to depression to physical strain to sleep deprivation to surgery to inflammation to exposure, etc., etc., as you can see. What happens is that when we are exposed to various stressors, that chemical input is mediated through our hypothalamus, mediated through our brain. And our brain really doesn't differentiate so much the different stressors, whether it's radiation stress and allergy stress or depression of some sort. The chemical output essentially is going to be the same. And what happens is that the hypothalamus outputs a chemical called ACTH. And ACTH flows through our body and tells our adrenal glands we need to produce cortisol. Cortisol is produced in an acute situation. The cortisol flows throughout the body, regulates inflammation, kind of mediates all cell function, and then once that stress is eliminated, the system returns back to normal. Now that's a normal situation. The problem is that the chronic stress response is when we have a multitude of different factors, different stressors, are constantly inputting themselves into our brain, and we get a chronic output of this ACTH. We then get a chronic output of the adrenal cortex with ever-increasing amounts of cortisol. And the problem is that over time, it tends to numb the brain's response to the cortisol, so it keeps outputting more and more and more ACTH. And over time, we start to run a deficit in the adrenal hormones. And when we start to run a deficit in the adrenal hormones and we get a ratio discrepancy between the adrenal hormones, we set ourselves up for various illnesses. We can create blood sugar problems, which can lead to diabetes and heart disease. We can start to demineralize our bones, which leads to osteoporosis. We can start to break down our immune system, which affects, our muscle system, which affects our immune system. High blood pressure can come about from this. And if you look all the way to the right, we start to severely affect the immune system. We break down the mucosal immune system, which is in our gut. We start to have an increase of things that then permeate through the gut lining, get into the bloodstream, and trigger inflammation. We get increased levels of immunoglobulins, which trigger more inflammation. And essentially, over time, we can end up with a variety of different chronic health conditions, from chronic fatigue to yeast problems to autoimmune disorders to cardiovascular disease, etc. Now, that could be an environmental Those can be environmental factors that are then overlaid on top of a genetic susceptibility. So one individual may end up developing something like MS, another may develop RA, whereas somebody else may be predisposed more to cancer. But the chronic stress response is important because this stress response leads to a breakdown of the body and increases the propensity for chronic illness. Now, this is another chart that's a little bit heavy to kind of, picture all at once, but let me just walk you through it because this is an important slide too. Our normal output of cortisol, see cortisol over here on the left-hand side, should be in balance with a lot of other hormones that our bodies produce. Aldosterone regulates salt and water retention through our kidneys. That helps to control blood volume and blood pressure. We output DHEA, which is a direct precursor to estrogen and testosterone. We have a relationship to progesterone through this system as well. So sex hormones, from progesterone to testosterone to estrogen, are regulated, if you will, through these metabolic pathways and these hormone pathways that are linked to cortisol. Now, the red arrow depicts what's called the preferential pathway under stress. So when our body is under stress, physically, mentally, emotionally, the preferential pathway is to continue to support cortisol essentially over everything else. And when we run into a chronic situation, over time we can create deficits in these other hormones. We can create deficits in progesterone, testosterone, estrogen, aldosterone, which has profound effects on the hormone system and the immune system. And then eventually over time we can run into problems where cortisol also becomes depleted. This is a graphic representation of the adrenal glands and the output of cortisol that happens with the different stages of adrenal insufficiency. In a normal individual, in a normal output of cortisol, you're going to get a fluctuating level that occurs over a certain range throughout the day. Okay? And if everything is in balance, then essentially we're going to have optimal health. As people start to move into a stage 1 condition, it's where the cortisol levels are now chronically elevated. And this is one of the first stages that happens before the symptomatology of a specific disease would manifest. Usually this is a state where most people will not feel really any symptoms. They're not really manifesting with joint pain or fatigue or inflammation of the body. They actually feel pretty good. But as time goes on, as those levels start to drop off, and if the chronic stress is not remedied, and the adrenals start to weaken, the cortisol levels start to drop, and they can drop even further and further to where eventually you can lead to complete adrenal failure. Now the problem is at this state, when the cortisol levels are high, and if they're chronically high for months and years, the body burns out. Okay, so it's sort of like running your car with, driving your car constantly with the accelerator pushed all the way down all the time. Eventually the car is going to wear out much quicker and you're going to run into engine problems. The same thing happens in our body. Because cortisol is, yes, a regulating hormone, but when it's chronically elevated, it creates havoc in rest of the cells of the body, and things just start to wear down and you get a problem over time. If you notice that this slide, we've got the cortisol marker right in the middle. Okay, it's basically the hub of the wheel. And it's the regulation of cortisol through proper adrenal function that has a direct effect on all other systems in the body. It has a direct effect on the balance of the brain and the nervous system. It has an effect on the endocrine system, so thyroid function, ovarian function, glucose regulation. It has an effect on protein metabolism, on how well our body detoxifies, not only just from heavy metals, but all of the metabolic toxins that our cells produce that we have to get rid of. And if we start to look at RA, for example, we notice that, a dysfunction in the adrenals can lead to a dysfunction of cortisol, which can create a situation where the connective tissue becomes damaged, the muscles become damaged, the bones become damaged, and over time, because cortisol actually acts as an anti-inflammatory, but too high levels of cortisol can be immune suppressive, we can run into a problem of chronic inflammation and the susceptibility to chronic infection. Okay, let me just skip ahead here for a sec. So from a general nutritional standpoint, and this, what I'll do is expand upon this concept of adrenal dysfunction with respects to RA in future presentations. But to just help remedy the situation for a lot of people, at least taking some things to take the stress off the adrenal glands, there are a couple products that can be quite useful. Now I use a product, I use a company called New Beginnings Nutritionals, and here's their website, nbnus.com. And just as a general adrenal support remedy, their Adrenal Essence is a nice remedy to use. About 2 capsules a day is kind of a starting dose, and this just helps give some herbs that just essentially help support the adrenal glands. Because if anybody with RA, you're going to have ongoing stress on a certain level. And to complement that is a product called Energy Plus. So the Adrenal Essence and the Energy Plus is a nice bridge, if you will, to just do some supplement therapy to support adrenal function. Is that the only thing you would do? Of course not. You wouldn't stop there, because many times you have to look deeper. You got to look at infections, dietary factors, etc. But this could be a good place to start for many people, just to say, hey, I want to take something that will help at least support my adrenals while I'm doing some other investigative work. Okay, so which then leads us to the discussion of what are some steps that I feel you must take to improve your condition with respects to rheumatoid arthritis. Well, one of the things is, as I mentioned before, is certainly performing some comprehensive testing. The blood work I mentioned before, the thyroid test, the anemia, comprehensive metabolic panel, those things have probably already been done, from your general practitioner, looking at inflammatory markers from the ANA, the RA factor, etc. Okay, that's all great. However, I think everybody should be doing some further testing. Salivary adrenal profile assessment to look at cortisol is critical. The organic acid test that Great Plains has, again, very important to look at the overall metabolism in the body, to look at yeast and Clostridium markers too. Food sensitivity testing to me is very important, as well as doing stool pathogen testing, comprehensive digestive stool analysis to see is there some type of infection in the digestive system that could be stressing the body? And I'll explain that here in a little bit, why that's important. The other things to look at is just reducing stress in general, improving diet, eliminate the foods that tend to be inflammatory, and incorporating more foods that tend to be healing. Improving digestive function, as I mentioned, and then a couple things to consider that you can discuss with your doctor is cyclical doses of antibiotics, something called minocycline, and potentially the incorporation of a remedy called low-dose naltrexone. Now, first off, let's just talk about some things that you can incorporate on your own at home. And primarily the main reason I'm introducing this is to try and reduce the stress response, that chronic stress response in the body, which taxes so many people with chronic illness, particularly taking the pressure off the adrenal. The adrenals can function more appropriately. And there's probably not one more single thing that you could do that's so important than to improve sleep. A lot of people with, chronic health conditions have poor sleep. Not everybody with RA is going to, have poor sleep, or anybody with other diseases is going to have poor sleep. But, poor sleep tends to be epidemic in our society. So a couple things to think about here. Sleep is one of the things that's important because proper sleep helps with the repair and the regeneration of the body tissues. We get an improvement or an increase in growth hormone through the middle of the night. We get a decrease in cortisol, which helps the immune system to repair itself, and essentially the body has an opportunity to try to heal. So I always tell people, look, you got to sleep in comfortable clothing. If you like sleeping naked, that's great. Okay, whatever you got to do to be comfortable. Make sure the room is cool. They've actually figured out that the optimal temperature for sleep within the room is somewhere between 60 to 68 degrees Fahrenheit. So, if you have to turn the air conditioner on at night, have a fan blowing to make sure that there's air circulating, all the better. The other thing is try to avoid consuming any caffeinated beverages, anytime after 4 p.m., whether that's coffee, tea, iced tea, or other caffeinated beverages, because those can definitely interfere with people's sleep. The other thing is make sure your room is dark. Just ambient light that's coming in from another house next to you or a street light can shut down your melatonin. And melatonin essentially is that hormone that our brain produces that is considered to be the molecular equivalent to darkness. So just ambient light itself can be a problem. I've had to have people get, dark shades or curtains to just darken the room. And I can tell you from personal experience, in doing that, greatly improves sleep. And then there are some natural sleep aids which can help. A lot of people are magnesium deficient. I like to give people anywhere between 250 to 400 milligrams of magnesium sometimes at bedtime. I like magnesium glycinate. Fit when they add a little bit of calcium with the magnesium at bedtime. However, if you're not doing magnesium, I would honestly just look to start with magnesium at bedtime and see how things go. The other thing is things that help with melatonin production. Again, probably one of the best things you could do is really darken the room, but you can also use some supplement therapy as well. 5-hydroxytryptophan, also called 5-HTP, is a supplement, natural supplement, that's converted into serotonin, which is then converted into melatonin. And anywhere between 100 to 300 milligrams, at night, about an hour and a half to 2 hours before bedtime can be helpful because it helps to naturally boost the levels of melatonin. One word of caution with 5-HTP, and I've never seen a toxic reaction, but it's just something to be aware of. If you are on a medication such as Prozac or Zoloft, some of those things called SSRI medications, if you're taking St. John's wort, etc., you have to be careful with using 5-HTP because all of those things have an effect on serotonin, and there is the potential, although I've not seen it, there's the potential of getting too much serotonin in using 5-HTP and one of those other medications. So if you're on one of those medications, you definitely need to check in with your personal physician to see if it's okay for you to take 5-HTP. And then some people do really well with just melatonin supplement. As I mentioned before, melatonin is that hormone that the pineal gland produces. It's the molecular equivalency to darkness. And comes in different strengths. New Beginnings carries melatonin, usually a 1 milligram tablet. And I have people start anywhere between a half to 1 milligram at night, sometimes 2 milligrams. You know, about 30 minutes before bedtime can be wonderful. Sometimes people need to take maybe another half to a milligram sometime during the middle of the night if they're waking up. But yeah, that's usually not a problem. So melatonin is certainly an option. Be cautious about taking melatonin beyond about 3 a.m. in the morning, just because it may make you really sleepy and groggy the next day. Okay, so a couple options there as far as natural sleep aids. Well, what about diet? Well, we could spend an entire 2 hours talking about diet because it plays a critical role in our health. It certainly plays a critical role in things like rheumatoid arthritis. One of the things that I have found helpful as just an all-around dietary program that people can incorporate that just improves health in general, gets more natural foods, whole foods into their diet, eliminates a lot of the processed foods, but gets a little bit more fine-tuned with respect to their particular body type is something called the metabolic typing diet. This has been around for a number of years. This book, particularly called the Metabolic Typing Diet, is quite helpful. And there's different types of body types. You know, we're not all the same type of people. We're all individuals. And we all metabolize things at different rates and at different levels. And with that, there are certain foods that are certainly in general healthy, but that one individual may do better with versus another. And that's the principles of the metabolic typing diet, is to try to optimize your diet specific to your metabolic type. And this book goes into that, trying to determine what is your metabolic type. And then removing those foods that are not optimal for you, okay? Because you can look at a certain food as being potentially harmful to your body. Certainly we know that a lot of the processed foods, the refined grains, the artificial colors and flavors are just toxic for most people. But there are other foods that, whether they're grains, you know, potatoes or rice, etc., that may not sit well with your particular body type. Okay, so this is I think, an important dietary intervention that can be looked into to just essentially improve your overall health. But with that, I think it's also important, specifically with respects to rheumatoid arthritis, to look at other foods that may have been known to further exacerbate the condition. Many people with saturated fats, fried foods, refined sugar and dairy products, gluten foods, alcohol, and caffeine. So the metabolic typing diet can help just incorporate a healthier diet. Sometimes you have to fine-tune it a little bit more by removing some of these other foods to see how you feel. And then some people with RA actually do even better when they start to avoid nightshade vegetables, tomatoes, potatoes, peppers, eggplant. And usually a trial basis of something like this for 6 to 8 weeks is enough to see if you feel a difference. So what I recommend to people is, you know, hey, you can start working on the metabolic typing diet, okay? And then to take it, you know, one step further, you can start to reduce or eliminate some of these other potentially inflammatory foods, whether that's dairy, whether that's gluten, eliminating alcohol and caffeine, to see if you get any additive improvement. And then working, you know, on a trial basis to eliminate some of the nightshade vegetables can be helpful as well. Now, if we look specifically at one particular food group that is most problematic for a wide variety of people with autoimmune conditions, probably number one on the list would be gluten. And this is just a research article that was published back in 2001 in a journal of rheumatology that was talking about the symptom improvement of rheumatoid arthritis through a gluten-free diet. And what their conclusion was is that many people felt better and actually had clinical improvement by eliminating gluten, specifically those people who had RA. Okay, so this is why many of the complementary medical practitioners that you'll hear talk about with respects to autoimmune disorders, they'll often talk about the problems that many people have with gluten. Well, gluten is, it's something that's found in a lot of different types of foods. But what we're commonly talking about when we're talking about gluten is what we're really referring to is gliadin. And the gliadin is actually a protein fraction of gluten, and gluten being found in many different types of grains. People with celiac disease actually have an autoimmune reaction to the gliadin. Okay, and it creates an autoimmune degenerative pattern in the body. But you can also just have what's called a gluten reaction that isn't autoimmune. It's not really involving an autoimmune process, but it is causing an inflammatory reaction. So the vast majority of people who have a wheat sensitivity, gluten being found in wheat and gliadin being found in gluten, it just tends to cause a lot of joint achiness. People feel more fatigued, they feel lethargic. But for people who have inflammatory joint disease, it's the reaction to the gluten is actually creating an inflammatory reaction which is worsening their joint condition. So again, not everybody with rheumatoid arthritis has celiac disease per se, where there's an actual autoimmune disorder to the gliadin protein, but the vast majority of people with RA have some type of gluten sensitivity that's just stirring up inflammation and worsening their condition. So at best, I suggest getting off of gluten, even on a trial basis of 3 months, because often people with RA will feel tremendously better. Their joints will feel better, they'll have less stiffness, they'll have more flexibility, and they just feel, an improvement overall. And the important aspect of this is that anything that causes a degeneration and a breakdown of the lining of the gut, whether it is a food reaction like gluten or dairy, whether it's a chronic infection, anything that disturbs the lining of the digestive tract is going to have an effect on the immune system and also lead potentially to systemic inflammation. And this has been found not only in celiac disease, but in things like ulcerative colitis and Crohn's disease that can then cross over and have problems with respects to joint inflammation and inflammation elsewhere. So, apart from a lot of the medications that are used for rheumatoid arthritis, whether it's steroid therapy, immunosuppressive therapy, etc., there are a lot of actually nice natural inflammatory support remedies that can be used. Turmeric, which is an Indian spice, actually has some really nice anti-inflammatory properties for joints, connective tissue, and muscle tissue. And again, these things are, the dosages here are suggestions, but I've often found that people, do well with about 500 milligrams 3 times a day, something like turmeric. Glucosamine sulfate is another remedy which is helpful for joint tissue. About 1,500 milligrams a day is a nice dose. An interesting remedy called MSM, methylsulfonylmethane. A dosage range is quite broad, usually anywhere between 3,000 to 7,000 milligrams daily. MSM also has some anti-inflammatory properties. If you've ever seen the advertisements for joint health and arthritis, you'll often find that they're promoting glucosamine sulfate, something called chondroitin, and many times MSM to just improve general joint health and flexibility. Bromelain is an interesting remedy. You know, upwards of about, again, 500 milligrams 3 weeks per day, similar to the turmeric, has inflammatory properties too. And then just improving healthy fats, you know, evening primrose oil, black currant seed oil, borage oil, you know, upwards of about, actually it should be, should be about 3,000 milligrams. There's a typo there. Daily, you know, can be helpful. So this is where we start to get into some of these natural remedies that are helpful for joint inflammation. So I apologize about that. That should be about 3,000 milligrams. Well, we talked a lot about chronic stress. And one of the other things that I find that helps people with rheumatoid as well as other autoimmune disorders that are affecting them is to work on sleep, as I mentioned, diet, but just mental emotional stress as well, because certainly having a disease condition like this can be stressful. And so doing some type of relaxation therapy can be great, particularly just doing it at home. Now, I've often had people, even with RA, who do well in taking a warm bath at night. Now, you have to determine for yourself if warm water actually affects you negatively, and if it does, this is something you want to avoid. But a relaxation therapy technique at night is taking a warm bath to just settle the body down. A lot of times people get benefit by adding some Epsom salt to the bath water, 2 to 3 cups. Epsom salt has added magnesium, which is relaxing. Sometimes people will add a little bit of lavender to the bath water, or they may use something like lavender, chamomile, or even peppermint oil and rub that into the joints, because it has a soothing and an anti-inflammatory effect as well. And I've had people do all 3 of these things, and just overall they feel more relaxed, their joints feel better, and it aids with a good night's sleep. In some people where the warm bath may be problematic for them, and I actually have people who don't, you know, they don't have bathtubs depending on where they live, there's another device that can be used called an alpha stem. Alpha stem technology it actually is approved for the treatment of pain, anxiety, depression, and insomnia. So this could be something that can actually be used to. They have little clips that go on the earlobes, and it sends these microcurrent pulsations that help to improve what are called alpha waves. Alpha waves are those brain waves that are activated that help in states of relaxation and calmness. And they've shown that the induction of alpha waves can help, again, in pain, decreasing anxiety, helping impression, and in sleep. And so it's a nice, safe, and effective, particularly can be an effective alternative to many of the harmful drugs that are used for these particular types of conditions. So you can learn about that if you go to alpha-stem.com. And again, as we refocus this discussion, we take it back to this aspect of the whole chronic stress response. We're trying to do as many things as possible to just decrease stress so that we can take the pressure off the body and get some normalcy back to our hormone system and our immune system. All right, let me just, we're going to wrap up here in a couple things I want you to be aware of. There's an organization called Roadback, and roadback.org, it's a Roadback Foundation, and they're dedicated to information and complementary therapies with respects to rheumatoid arthritis and other autoimmune disorders. I highly recommend, if you don't know about Roadback, is to go to their website and get familiar with their information. Because it was through roadback.org that I learned about the work of a Dr. Thomas McPherson Brown. And there's a book called The New Arthritis Breakthrough. It's been out a number of years, written by a Henry Scammell. And it was highlighting the work of Thomas McPherson Brown, who's an MD, he's dead now, who treated thousands of patients with rheumatoid arthritis, other autoimmune disorders, connective tissue disorders like lupus and scleroderma, quite successfully in using cyclical doses of antibiotics. And it was Dr. Brown's theory is that the vast majority of immune disorders within this category of connective tissue disorders were being triggered by some type of infection. So if you don't have this book, I highly recommend getting it. So what I've done in my practice for many people with rheumatoid arthritis is used cyclical doses of minocycline. Minocycline is in the family of tetracycline antibiotics. And minocycline, also called minicin, dosed at 100 milligrams twice daily for 10 days, then followed with 100 milligrams twice daily, Monday, Wednesday, and Friday, has had tremendous benefits for people with RA. Now the treatment course may take a few months to really start to see optimal results. I've had some people who have been on it for a number of years, their disease condition at remission. But the medication is well tolerated, and many times the treatment effects of this therapy are quite remarkable. So again, Dr. McPherson Brown primarily used tetracycline, way back in his practice many, many years ago. Minocycline is a newer form of tetracycline, tends to have a little bit, I think, better anti-inflammatory effects than perhaps just straight tetracycline. Interesting that minocycline has also been investigated as a treatment in certain neurological conditions that deal with inflammation. It's actually been something that has been considered and used, periodically in autism intervention to try to decrease brain inflammation. But it clearly has a beneficial role in the rheumatoid arthritis category, and I think it's definitely a worthwhile thing to pursue. Any of these medications like minocycline, just like you'd have to be cautious with tetracycline, is the potential for sun sensitivity. So people who use these do need to be careful about being in the sun for too long. Any antibiotic is going to have the potential side effect of vaginal and intestinal yeast overgrowth possibilities. But one of the things that Dr. Brown highlighted and in this particular book called The New Arthritis Breakthrough is that he actually treated quite successfully over 10,000 patients with various connective tissue diseases, from rheumatoid to lupus to scleroderma to other types of inflammatory arthritic conditions with tremendous success. Many people who had either failed traditional therapy, had toxic reactions to things like methotrexate, and just were not progressing. And so, again, the theory is that there is some type of bacterial infection that is likely triggering the immune system to attack the joints. This has been theorized in things like MS and certainly been theorized in other types of autoimmune disorders. Now, why the cycling of antibiotics? Why not use something like this continuously? Well, the 10-day period of time where you hit, right off the bat with 10 days of something like minocycline appears to be a good time frame to really initiate the killing of pathogens, but not too long where you would discourage the pathogen to gain resistance. Tetracycline-based drugs generally tend to stay in the body for about 48 hours after oral dosing, and that spacing is enough time to make sure that there's still good coverage within the body tissues. One of the other reasons about the cyclical dosing of something like minocycline over time, tetracycline too, is that you decrease the chance for hypersensitivity reactions. Any antibiotic, you can potentially develop an allergic reaction, and really any drug you're taking, there is the potential for hypersensitivity reactions where the immune system just becomes hypersensitized to it, and you can develop skin lesions, etc. That's greatly reduced when you're cycling the medication. So that's one of the reasons for the cyclical aspect of the minocycline. So again, I highly encourage you to read that book, The New Arthritis Breakthrough. Check out the information at roadback.org, because if you don't know about this, you need to, and you can talk to your doctor about it. because it's an effective treatment, easy to do. The medication is really inexpensive, and I have just found that many people get tremendous benefit from it. Well, one of the reasons I mentioned early on about doing the organic acid test from Great Plains is you want to evaluate not only for yeast and to look at other factors with respect to body metabolism, but also to identify the potential presence of Clostridia bacteria. This was just one research article I pulled up talking about a specific type of Clostridia called Clostridium difficile. Now, you've probably heard about Clostridia difficile infections in the hospital setting now, where there's a lot of people that develop Clostridia difficile. It's very problematic. It can lead to severe inflammatory bowel disease, and it's becoming even more of a resistant bacteria. The reality is that there's a lot of different Clostridia bacteria, Clostridia difficile just being one specific kind. And this was an article that was just talking about reactive arthritis, an arthritic inflammatory condition being triggered by a bacteria, this specific bacteria being Clostridia difficile. Okay, and when you do the organic acid test, there's a couple markers. One is called HPHPA, which is specific for Clostridia bacteria in general, and it's not listed here, but there's another marker called for creosol, which is more specific for the Clostridia difficile. Many times when you do a stool test, some of the labs will just test specifically for Clostridia difficile. They'll look for what's called toxin A and toxin B of Clostridia difficile. But oftentimes they miss it, or they may not detect Clostridia difficile, but they're not testing for the other types of Clostridia. And that's why the organic acid test is so important, because it's not only going to detect the 4-creosol marker, which is specific to the Clostridia difficile, but it's going to detect the HPHPA marker, which is specific for the other family members within that Clostridia family. And Clostridia is a nasty bacteria. It's an anaerobic bacteria. It doesn't like oxygen. It lives in the deep recesses of the bowel. Excuse me. Let me see if I can get this back. Where's my cursor? Okay, there I am. Sorry about that. Okay, it lives in the deep recesses of the bowel. It creates a tremendous amount of toxicity, and it's incredibly difficult to kill. It's resistant to many different antibiotics, and so sometimes you have to use specialized antibiotics like vancomycin or something called Flagyl to try to get rid of it. And there's specific protocols for the treatment of Clostridia. So, will something like minocycline, specifically kill Clostridia? Probably not to the degree that something like the vancomycin or the Flagyl would. I've seen a lot of people who've done well on the minocycline protocol who didn't have Clostridia. But if you have Clostridia, it too needs to be treated, and it needs to be monitored, and really one of the best ways of doing that is through the organic acid test. That doesn't mean that you couldn't also in time do something like the minocycline therapy, because it's difficult to say, is Clostridia the only trigger for RA? If you find it, it may certainly be a significant trigger for it. Doesn't mean there couldn't be some other type of bacteria. So a lot of times when you come to these types of treatments, you have to try a specific course of treatment to see what the clinical effect would be. So you could do a course of treatment for something like Clostridia to see what kind of effect that has on your overall condition. Maybe it helps but doesn't completely help 100%. At that point, you maybe have to move into something more like the minocycline therapy as well. In most of the people I've seen with RA, from my experience, about, I'd say probably at this point, about 30 to 40% also tend to have some markers of Clostridia. So not everybody that I've evaluated with RA has it, but I think it's a very important thing to evaluate for because of the underlying stress that it has on the body, chemical reactions it has on them. Replenishing those probiotics is really important. New Beginnings actually has a really nice high-potency probiotic called ProBio Premium. Usually a half to 1 packet a day. You know, if you're using antibiotics, you want to make sure you take it away from the antibiotics. I usually, if people are on antibiotics, I'll have them, you know, dose this to probiotics have a chance to recolonize the gut. But ProBio Premium is an excellent probiotic to help replenish the gut flora with antibiotic use. At a high dose is an opiate blocker. It's often used for people with morphine addiction, alcohol addiction, and heroin addiction. But used at a low dose, usually around 4.5 milligrams 1 time per day, dosed in the evening, has had a profound effect for many people with respects to autoimmune disorders, and I have found specifically with respects to RA. What it's doing is it's having a partial blocking effect on certain endorphin chemicals that have a relationship to the immune system. And so primarily when we're talking about immune condition, we're talking about an aspect of the immune system that's overactive, and it's acting in a deranged way. And the low-dose naltrexone helps to bring more balance to the immune system. Dr. Bahari actually found that when low-dose naltrexone was used at 1/10 the normal dose of somebody who maybe was using it for heroin or morphine addiction, helped to boost the ability of the immune system to fight a disease process while at the same time decreasing the autoimmunity of a dysfunctional immune response. In my experience, low-dose naltrexone has been safe. It's not been reported to be addictive, and it's not been reported to be damaging to the body tissue. Generally, most compounding pharmacies will make it in a capsule form, although some will make it in a cream. We've used the cream with kids. We've used it quite a bit with the kids on the autism spectrum. But my preferred way of using it is a capsule. The timing of it is important too. It's generally taken at night between the hours of 9 p.m. and 2 a.m. in the morning. So I usually tell people who are going to bed at 10, 11 o'clock at night, just take it before you go to sleep. Because it's that specific timing of the low-dose naltrexone that has that partial inhibitory effect on these endorphins, and then there's a counter-regulatory or a counter-compensatory increase in these endorphins throughout the night. So that's why the timing of it is important. Now, it can be compounded at different strengths. I've done low-dose naltrexone with people with MS. In a typical adult, we're trying to get to a 4.5 milligram dose per evening. And the capsules are made in what's called a non-sustained release form. So it needs to be non-sustained release because we don't want a slow absorption of the low-dose naltrexone. But in people with severe health conditions, sometimes starting at a 4.5 milligram dose is a little bit too much for them. They might feel a little bit reactive initially, maybe a little bit more fatigue, whatever it may be. So it can be compounded at any strength. I will typically, in sensitive people, compound it at about 1.5 milligram capsules. And then we'll start it slowly. We start at 1 capsule at 1.5 milligrams nightly for 7 days. Then increase it to 2 capsules for another 7 days. Then increase it to 3 capsules for another 7 days, and then we'll continue with that dose at 4.5 milligrams thereafter. And that seems to work well for a lot of people. The optimal time frame of low-dose naltrexone is variable. I think anywhere between 4 to 6 months should be considered as an initial trial of low-dose naltrexone. Some people need it longer. As I mentioned before, in some individuals with RA, initially they may feel an exacerbation, but that's I generally tend to be a little bit more conservative, dose it a little bit slower so that people's body have a chance to kind of get used to it. But the benefits can be tremendous. Decrease inflammation, decrease pain, increase flexibility. But during that low plus the minocycline, like typically when I do something like the minocycline in the Wednesday, Friday, also then look to incorporate the low-dose naltrexone effect on the immune system, and many people do exceptionally well with that treatment program. By the way, I mentioned earlier, if you want to learn more about low-dose naltrexone, go to lowdosenaltrexone.org. That website will go into it in great depth. The nice thing about low-dose naltrexone is it's really inexpensive. It's not an expensive medication. Last time I checked, and don't quote me on the prices, because I know this is being recorded and it'll be up for years, but on average, $40 to $45 depending on the compounding pharmacy. So it's not a real expensive remedy. Okay, so that's the information for tonight. I hope you found that helpful. I know it's probably a mouthful of a lot of different kinds of things. I am available for consultations. I have office consultations that I provide in California as well as Oregon. These are required in order to obtain prescriptions, things like minocycline or low-dose naltrexone. However, I also consult with individuals through phone as well as internet, to do test interpretation, give feedback based on protocols, help guide a process with respects to treatment, work in conjunction with your personal physician if you can't travel to see me. So there's a wide variety of options with respects to consults. You can email my office contact information at info@mysunrisecenter.com or call 951-461-4800. So I hope this information was helpful for you tonight. I'll be doing some further webinars on the aspect of rheumatoid arthritis. And again, if you want to find out more specific information about me, you can go to drwoeller.com. Thanks everybody for joining me, and we will see you next time. Thanks so much.